This video is all about head injuries. There are three types of serious head injury: concussion, compression and a skull fracture. Concussion is when a sudden jarring or impact causes the head to move violently and the brain moves inside the skull. Compression is when there is swelling or a bleed in the brain causing pressure inside the skull. A fracture is when the skull has cracked or broken. There are lots of signs and symptoms of a serious head injury. When assessing a person who has had a bump to the head, first of all consider the mechanism of injury. What was the force of the impact? For example, falling and bumping your head on grass is significantly different to hitting your head on ice. A punch from a 4-year-old is different from a 21-year-old. Being hit by a car at 5 miles an hour is different from 40 miles an hour. This may help with your decision making later on. Work out whether the incident was high or low mechanism of injury. Then signs and symptoms of someone with a serious head injury may include blurred or double vision, loss of memory, loss of balance, reduced motor function, bruising under the eyes or the ears, dizziness, nausea and vomiting, headache, clear discharge appearing from the eyes or ears, unequal pupils, confusion or irritability. If someone has bumped their head, first of all sit them down. After introducing yourself and gaining consent, find out how the injury was caused. Check for any external injuries such as a bleed or swelling. Use a bandage to apply pressure to any bleed or a cold pack to reduce any swelling or lumps. Then assess for any signs and symptoms of a serious head injury. You could ask them questions about how they feel and look out for signs and symptoms like of nausea, dizziness or a headache. You could ask them to stand up and test their balance and ask them to touch their nose or fingers together to test their motor function. Look at their eyes to see if their pupils look unequal or reactive to light. Look for bruising around the eyes or the ears and try to ascertain if they are acting normal for them. If they have any signs and symptoms, you should seek further medical help by taking them to A&E, calling 999 or 111 if you need advice. You don't have to remember all of these signs and symptoms off by heart. You can always use the NHS website for guidance and to pass on advice to the person. If you do not see any signs and symptoms of a serious head injury and they don't need any further treatment for any external injuries like stitches for a cut, then they can carry on with the rest of their day, but give them some advice. The advice is that they should not be left alone for 24 hours because symptoms can be delayed. If the person is a child, make sure the adult you are passing them on to knows about the injury and tell them to seek further medical help if any symptoms appear. So to recap, most head injuries are not serious, but you should seek further medical help if the person has any signs and symptoms of a serious head injury, and they should not be left alone for 24 hours after the event. Thank you for listening. I hope you found this helpful.